Thank you very much, Dean Hubble. Good morning, everyone. My name is Austin Turner. I am the chair of our Advanced Imaging Programs and Pathways and the head of our computer tomography program here at St. Louis Community College. So let me be the latest to welcome you to our campus and to today's conference. I'd like to invite our first panel list of speakers up here, if you'll join me up here at the table over here on the left. It is my honor and privilege to be the moderator for our two panel discussion sessions today on our agenda. Once they get seated, we'll have our distinguished speakers introduce themselves to you so you know who we have today. As you heard, we'll have a list of questions that we have pre-populated up here on our PowerPoint that we'll go through with our speakers. If you have a burning question or something you'd like to interject on any of these topics, please let us know and I will run around and find you with my microphone. But hopefully we'll also have some time at the end to open it up to some audience questions. I will let our speakers introduce themselves to you.
My name is Deanna Barklage, and I am with State Fair Community College. I'm the program coordinator for the Behavioral Health Support Program.
I am Dr. Jordan Cooper. I am the Division Dean and Director of Nursing here at St. Louis Community College.
If I can take just a moment to interrupt, I apologize. I want to give a shameless self-promotion. We just found out that Dean Cooper was named to the 40 Under 40 list by the St. Louis Business Journal.
Hey.
For his tireless efforts in expanding access to nursing programs and trying to address the workforce in St. Louis. So congratulations, and I would say enjoy that 40 under 40 while it lasts. Some of us are angling for the 80 under 80 list right now.
I had 6 months. I barely came in this one. So.
Sweet spot.
I didn't win and I wasn't going to get it. Okay.
Congratulations.
Thanks, Dr. Turner.
I'm Beth Camp, Manager of Learning and Organizational Effectiveness for BJC Healthcare.
And hi, I'm Jill Williams, Vice President of Workforce Development at Missouri Hospital Association.
Again, welcome and thank you to all the members on our first panel today. And as you can see from the agenda, we're going to be talking about not just the state of Missouri's healthcare workforce, but how do we educate to that. And hopefully you've had a chance to see the reports that come out of MHA about the workforce. Jill does a wonderful job of putting those out there. And if you haven't seen the report from 2024 that came out earlier this year that looks at the data collected over 2023, it's somewhat promising in that we're seeing improvements in openings of positions and ability to fill these positions across Missouri. Improvement from the previous year, but still not back to where we were pre-pandemic levels. And for many of us, you can see that there's a lot of openings in these positions across the state. And if you saw the report, the top 10 list of openings, 3 of those positions are in nursing and direct patient care, and 4 of them are in medical imaging. So I'm keenly tuned in to where all of these openings are across the state of Missouri. So if you wouldn't mind sharing for us, unique to each of your perspectives, how would you compare Missouri's current healthcare workforce with other states in the Midwest or other regions of the country or even nationwide?
I'll speak from the behavioral health perspective. I would say that Missouri we're on the cusp. I think for a lot of states, behavioral health has kind of been on that back burner for a long time, but because of COVID, that really brought behavioral health back to the forefront, and we had to figure out how are we going to meet the needs of the people in the state. So listening, I was just at a conference a couple of weeks ago, and I was able to listen to policymakers who are addressing things on the federal level, and they are telling us that Missouri is ahead of the ballgame, that as far as nationwide, Missouri is making things happen with behavioral health. And so that is extremely promising to me. As far as the things that we're doing, behavioral health, Department of Mental Health has worked out. We are the 7th community college in the state to launch the Behavioral Health Support Program. So we are able to train students to get out into the field much earlier than historically with a 4-year degree. Now we're getting them trained and ready to meet the needs of people in just 2 short years. And we're able to do that while students are actively working in the agencies. So with our contracted agencies, they are doing a minimum of 300 hours in the agency over that 1 year. And I think that there's really no better way to educate them. We can have them in our didactic portions and tell them all about the things that they're going to see and how they're going to need to meet the needs of these individuals who are in crisis. But to actually get them out there quickly, I think that that is one of the biggest things that we can do for them. But also, historically, we know that people have been pouring out of this field because they're burnt out. They're not taking care of themselves. And so we have the opportunity to teach them very, very young that that is one of the most important things that they're going to be able to do to be in this field for quite a while. So teaching them that their self-care is just as important as the care for the people that they're working with.
Great to hear that Missouri is leading in that area. That's good to know.
As far as we know, there are no other states that have this
Wow.
program. So we are trying to get out and talk with people nationally about how this is being successful.
Thank you. That's great to hear. Dean Cooper, from your perspective from nursing, what do you think about how we compare to others?
Missouri is in a really great place because not only do we have a lot of colleges, so we've got 4-year colleges, 2-year colleges, but the hospital partners do not put a restriction on whether or not an associate degree versus a bachelor's degree is the minimum standard for entry into practice. I know that we have a lot of graduates that will leave our college and they can work anywhere, and I think Missouri is roughly around, it's always kind of been about 50% of the total number of registered nurses in the area, not including like advanced practice, but registered nurses, come from community college or have an associate degree for entry into practice. On the coasts, they have a boundary that says you must have a bachelor's degree in order to practice, so they have a much higher shortage, hence why they also come with more burnout and more overwork because there is less of an actual workforce to be able to provide to those areas. Most of the nurses that I know that we graduate usually end up taking travel contracts after their bachelor's to go supplement the coast because they are so short. And so one of the things that Missouri's always done very well, and I think regardless of politics, just in general, Missouri has always come together to support healthcare and to support education, and it's been very, very noticeable in the last several years. Governor Parsons has given so much money to both community colleges and 4-year colleges, and that's helped increase enrollment, retention. We've been able to utilize more resources, focusing on things like behavioral health that are essential for us to get these students through that. So as long as we continue to build on that, Missouri is going to continue to be at the forefront of workforce development.
That's good to hear. It's interesting you mentioned the East Coast, the Mercer group that does business and data analytics. They came out with a report just a couple months ago, very similar to the workforce one. And they're projecting that over the next 5 years, nationwide, there will be over 100,000 healthcare position openings. And that's nationwide. But then they specifically single out the East Coast and the state of New York. And a lot of it has to do with what you said. They have requirements about who can do what profession there. And tens of thousands of nursing positions are going to be open in the state of New York, and we see some of those openings here in Missouri, but we're not going to be in as bad of a shape as the East Coast will be because a lot of those regulations they have enacted, like you said.
Correct. The Nurse Practice Act is, or not the Nurse Practice Act, the multi-state licensure through the NCSBN. They actually allow for a nurse who is licensed in one to have a license in a compacted state, and a lot of the coast, especially the East Coast states, are not part of that compact. So as the dean and the director of this program, I have to sign off on those things and verify our education. Almost exclusively, it is Massachusetts and New York. And that is where the heaviest hit for them is. I know that Dr. Pittman, Dr. Hubble, and I, when we went to do the Bellwether competition in February, it seems like forever ago, we would see all these great schools doing all of this great work. And then to kind of humble brag on that one a little bit, we step back and go, but we've been doing that for years. But I think it's just us having the wherewithal to know this is the direction we're going and to really go full force into student support, student resources, and then to advocate for expansion, not to lower standards, but to remove barriers for entry. And that's just one of the things I think in general, a lot of colleges in the Missouri area and a lot of colleges in Missouri have already acknowledged. Removing barriers is the key to making an additional workforce.
That's great. That's one of the topics we actually want to get to later today. How about from our healthcare partner side?
Well, removing barriers is like something I feel like I repeat that's a word I repeat constantly. And what has been exciting in, I'd say, probably the last 12 months is the amount of leadership at our organization that I'm seeing that's really starting to hear that we have a wonderful tradition of providing tuition benefits to every single employee. They're available the day that they start. They're really starting to understand that tuition benefit is a piece of that puzzle. There's other, like, more flexible schedules for students, and really creating a career path that can take someone who might come to BJC and work as a food and nutrition work, on that team, or housekeeping, or many transporters. Getting all of those entry-level people to understand that if they stay at BJC, we have a path for them, and we're going to support them to move them into those nursing and other high-need allied health areas. So that, when I talk about that in other places, kind of similar to what you just said, people go, you're doing that? You're making that opportunity available to all of your employees, and we really are. And so the more, like, our community college partners are absolutely indispensable in that. And it truly is partnership, but hoping that the workforce in the area sees like that's an opportunity for them that will give them growth and financial security and opportunities well beyond what they'll initially experience is really exciting.
That's a great program. And I apologize, Jill, if I'm stealing some of your thunder, to reference back to that.
Don't take my whole speech.
to reference back to the workforce report, again, from earlier this year, it highlights that a lot of turnover is in some of those non-clinical support roles that may not have education requirements. Transporters, environmental services and housekeeping, food service, working in the kitchen. The positions that still very much have an impact on patient care and how we work in the healthcare environment, but they have such high turnover. So being able to provide support services for people in those positions as well is just as critical as our healthcare positions. So that's good to hear.
Yeah.
Jill, I apologize. Please go ahead.
No, you're fine. You're fine. So, in most states across the United States, I have a counterpart at other hospital associations, and we meet every month and in person once a year. And overall, in general, we are all in kind of the same boat of dealing with a lot of the same challenges across the healthcare industry. The demographic shifts, we have that population that's nearing retirement that is going to be seeking more healthcare services. They are also retiring from our workforce, and in your case, our education system. We also have, the younger, we have declining birth rates. We have that younger generation that are in high school now or in their early 20s that's just smaller than the generation that's working right now. So just in reality, we're going to have to find ways to do more with less. Also, the work-life balance was mentioned earlier. We're seeing in students and adults that need for more flexibility in when they work, how they work, and what that looks like for them. The burnout was mentioned as well. We know that these jobs in healthcare are emotionally taxing. They have long hours, and the burnout and exhaustion just kind of continue. So those are all some of those challenges that we just continue to deal with, I think, across the board in any state, including Missouri. You mentioned the Mercer report. I had actually written down Mercer because if you saw that report, it actually stated that Missouri is going to have a surplus of nurses. In, I can't remember if it's 10 years, 5 years, I can't remember what the time frame was. So of course I got like tons of emails. Have you seen this report? Have you seen this report? And I'm like, I don't believe it. I said, I have reports that I have saved from 10 years ago that said in 10 years, Missouri was going to have a surplus of nurses. One that even said physicians, and we don't have either. We don't have a surplus in either area. So there's just still a lot of work to be done. But I think in Missouri, some things that stand out to me, and again, I don't want to be a bragger either, but when I look at our hospital association compared to others across the state, we're almost like the gold standard. Other states look to us because we have been in this workforce space for much longer. Several other hospital associations did not even hire a workforce person until the pandemic happened, and it's all of a sudden like, oh gosh, we need somebody focusing on this. So we have a lot of long-standing relationships and initiatives and programs that we've been running. Many other states have purchased our clinical faculty academy, and we've talked to schools across the nation and helped them get that set up in their state. We also have a great state board of nursing. So as I talk to other hospital associations across the state, many of them do not have good relationships with their board of nursing. Their board of nursing is not innovative at all. They're very old school, stuck in their ways. And I feel like our board of nursing is not that way. They do try to hear us and to try to innovate and make changes in the way that we need those to be done. So I think we've got a lot of great things going for us in Missouri, and as you'll see in my presentation later, how we're continuing to work to partner and bring education and our healthcare organizations together in new and different ways.
Thank you very much. And you mentioned burnout, and I looked at some of those numbers from the Mercer report and kind of raised an eyebrow as well. But I think that there's a buried component in there where you're right, it says that we're going to have a surplus of nurses here within 5 years, whatever that period is. And you turn a page and it says we're going to have a deficit of nursing assistant roles. And the problem is some of these reports or people that look at it from a high level don't see the interconnectedness, the interprofessional relationship with which our positions work together in the healthcare environment, and we tend to adopt that siloed approach. And they don't realize that when you have a deficit of nursing assistant roles, that puts more pressure on the nurses to work harder and work more, which leads to more burnout, which now here we are later on and we have those deficits. So I think really looking deep down at some of the numbers and how they're interconnected is going to give us a better idea of what we're actually going to look like in our workforce. So we talked about barriers earlier and trying to remove some of those barriers. What are you seeing as some of those challenges and barriers to trying to improve our workforce? And what are you doing to try to address those? Are they unique to Missouri and the Midwest, or is that something that's addressing everybody nationwide?
I think always the challenge, or barrier is just funding is always something that we are up against. So specifically in behavioral health, we've always had that challenge with having enough funds available to meet the needs. So I think with launching programs in places, a lot of times, especially with my program, the AAS and behavioral health support, it's not a licensed position, and so without that, without that licensing element, we're not allowed, we aren't able to really collect as much in the tuition and things like that, which helps, it limits the amount of students that we can train to get out there. So it puts a little bit more burden on our staff. But it also then causes some people to kind of look at it and say, well, is that going to be adequate enough for me to get out into the field? And so they look at other programs. So I think that funding piece is really important. As far as whether they're unique or different, I believe that it is unique, and we have the availability of it in central, in our Missouri area, but it's very spread out, and so it allows, people have to be in that right area of the state to be able to partake in that. So if that makes any sense. So.
Thank you.
One of the big things that I can say that has been the biggest barrier for my faculty has been the lack of ability to continue with compounding knowledge in this current generation of students. So nursing program, it's not nursing, it's all healthcare related programs, these cohorted programs. We learn anatomy and physiology, and we learn chemistry, and then they learn, math, fractions, and it just kind of goes to the wayside. And then they come back in, and then it's like, well, what do you mean that's a fraction? I don't know how to do that. And so I think one of the biggest issues is attuning what we know as a tried and true traditional model of education, and then augmenting that now and very quickly to a very new kind of student. How do you increase your ability to hold up your standards and keep your rigor without necessarily knocking out students who otherwise could have an opportunity? And that's where one of the challenges that we're working on is balancing. How do we balance rigor and expectations versus innovation and support? And actually, and I'm going to have to call her out, Amy Pennick is one of our new retention coaches in the health science division here at St. Louis Community College. We already have them in nursing, and she's the first one for the health science. And the idea is that this is a person who is not a faculty member, it is not a academic or a student affairs academic advisor. Their goal is to find them resources. So are our students not making the grade because they're working too much, because they don't have enough scholarship opportunities or because they're having to work full time. Their role is to find those resources to help remove those barriers. But getting those students to come to us and be vulnerable and identify their weaknesses and their shortcomings so we can help assist them has been one of the harder issues. Is it a shortcoming of the college, or is it a barrier we can help remove the student just needs to be forthcoming about? So they are more multifaceted than they had been. It is no longer just I want to be a nurse and I will do whatever happens, or I want to be, radiology technologist and I'm just going to go through the program. There is more going on here. The average age of nursing student in my division is 31.
Wow.
Some of these people haven't been in school in over 15 years. Some didn't graduate high school and then came back, finished a GED, but knew they wanted to be a nurse. How do we get them to that level? Because we're not in a place to say, well, we don't want nurses.
And I wanted to kind of add to that. We see that as well, but on the flip side, we're also seeing a lot of students that are able to take dual credit in high school. So in some programs, they're coming to us a lot sooner, but there are barriers in place that keep them from entering the workforce. One that most recently came to my attention is in my last cohort, I had 2 students that came into my program. Their prereqs were met, and so they applied to the program their freshman year in college, and they were out in the workforce doing their practicums, but the workforce needs them to be age 21 in order to be covered by their company's policies. And so here we are saying, we have this shortage in the workforce and we're going to get you out there quick, but we're going to have to put you in another role until you hit 21, and then you can get that job that you've been training for. So I think we have to look at what is it that we can do to help that be more feasible for our agencies so that they can take advantage of these highly trained, skilled and ready to do the job. And we're able to get them there quicker, and they're eager to be there. They've worked really hard to get that done quickly. We want to make sure that we can put them to work in a place where we need them.
And I'm going to brag on our clinical partners a little bit here. We just started our first cohort of our LPN program, which we had never had before at the college. And we didn't necessarily need to open it, but the goal was that we wanted to increase the workforce. And the first thing we did was go to our partners at BJC and SSM and Mercy and say, LPNs had gone to the wayside. Now we know we need qualified healthcare providers and we have this opportunity. Would you support us doing this and making an avenue for them for employment and for progression? And they absolutely came back and said, if you guys are going to do this and have the same expectations and outcomes that you already have, absolutely, then we will support your LPN program. And so creating more opportunities for entry and pathway into it, that's been one of the biggest goals that has been on my mind anyway. So.
That's great. Beth, from the hospital side, what kind of barriers or challenges do you see into hiring to fill these openings?
Oh my goodness. So I've spent a lot of time in the last several years really focusing on the training programs where someone can enter the healthcare workforce. So these are non-degree programs. Again, we partner extensively with a community college in the workforce space around PCT, or that's very similar to CNA, nursing assistant, medical assistant who work in doctor's offices. We have an exclusive central sterile processing tech, which probably many of you are like, and what's that? But that is truly what keeps a hospital able to do surgery. They function 24 hours a day. We are adding our monitor tech program this month. We will launch our first cohort. These are individuals who are sitting in a remote space, actually just a few blocks from here, and they're watching patients throughout. They're eyes for the nurses. They're monitoring multiple patients throughout our entire system, and they can alert quickly when a nurse needs to intervene. So that is the space I work in. I have a lot of passion for these students. I'm excited for them that they're getting to this opportunity to take a first step into healthcare, and they are an incredibly fragile demographic. In the years that I have done this, I have witnessed we have lost students because of domestic violence, because of instability around their housing, around their transportation, around their social constructs, around their ability to get food for themselves, food for their families, and a huge one, childcare. And So, I meet them a lot of times just as they enter the program, and I explain to them all the things that they can have at BJC. And I will tell you, I tell everyone this, please do not look at one of these programs as a strategy for retention. That's how we started. We thought, if we train these individuals, they're going to stay with us forever. Some of them do, but the challenges of both, like, what happens on the job and then their needs in these other spaces will often pull them away from work, and that is just how it is. So that is our biggest challenge and barrier, are the social needs to keep them right. We're right alongside each other to help this demographic. Now, all of that to say, from my very first PCT cohort at Barnes that graduated in October of 2019, we have had them complete nursing school. Like, it does happen. I want it to happen, 80% of the time, not 20% of the time, and that's a lot of work. So and it's interesting. People assume things like, well, we can ask a PCT to go from hospital to hospital to float. No, not if they don't have a car, or they can't afford to put the gas in the car. Sometimes people think it's so easy, and I've learned that it's really challenging, but it's also super rewarding. I personally, my grandmother became a nurse, and it changed the whole trajectory of my family. I know that as a fact. And I see them stepping into that opportunity, but it's more than building the program. And it's all of these things to help get them all the way through. So that's what we're seeing.
That's great. Jill, what are you seeing at a state level?
Yeah, I would say pre-professional, like most of you know, and we've kind of talked about, our healthcare, many careers in healthcare require training and certification, and that's just the way it is. And students do face a lot of barriers, whether it's personal, financial, childcare, transportation, and those things do limit their access to education, which then limits their access to receiving that training and certification. Also, that lack of awareness of healthcare careers at its most basic. What these other careers that are other than doctor and nurse. I mean, Beth just mentioned 2 or 3 of them right here today that most students would not know about to even explore to go into that field or into that career. So I think those are kind of on the pre-professional side, but then once they get employed, in a hospital, I'm thinking about other things like that burnout and job satisfaction that I mentioned earlier. Hospitals really needing, and many are doing a good job of it. Many have, ways to go, but improving, decreasing that stigma around mental health and providing resources and opportunities for the current employees to seek those resources. Also, education and training gaps. We know that students during the pandemic did not get many of the hands-on experiences that they would have, whether it be in nursing school, medical school, et cetera. And we are still hearing from hospitals, as that has kind of trickulated through, a need for creating more robust orientation and preceptor programs to make sure that these students, now employees, are confident in their clinical skills and they're confident talking with patients and families. And then the last thing I think about is that, as I mentioned earlier, again, that work-life balance. We're hearing a lot about that and that flexibility from our current employees. But I think things are changing and innovating in that space too. Right here in St. Louis, we've got several hospitals that now offer kind of the gig-based work model where people can choose where they work, when they want to work, how they want to work, incentives for maybe picking up various shifts on demand, and they can do it all from their phone. So again, just continuing to innovate in that space as well.
I do have one quick question on this before we move on. Since looking at the state level, and since we have representatives from multiple institutions here, are there any unique barriers or challenges that you're seeing in some of the more rural parts of the state, as opposed to, say, St. Louis, Columbia, Kansas City, even Springfield, where we have a glut of healthcare partners and clinical opportunities and educational programs? I see in some of those different regions, obviously, where we have more openings, more turnover. So what are the barriers or challenges in those areas?
I think a lot of those are just kind of what we know, just the access and the distance to healthcare facilities, to our educational partners. It makes me think I was just talking to AmeriCorps this week. So they have a Health Corps grant, and we're going to go, Missouri Hospital Association is going to try to go for some funding to do a pilot program. And that really, AmeriCorps pays students either in high school or college to work in a healthcare setting. They are employees of AmeriCorps, but they will work for the hospital or healthcare organization. And it's a great kind of win-win situation for the student and the organization and the school. But one of the things AmeriCorps said was, in order to get this grant, what would probably best is if you choose a rural area, and we'd like it to be Southeast Missouri if possible. Like, well, that's kind of our healthcare desert. So finding the hospitals or healthcare, even healthcare organizations, doesn't have to be a hospital, with the size that can take, multiple students, because we need X number to apply for the grant, and a school in that region where the students can go from school to work and home is a challenge. So we're trying to kind of figure that out and see how we can expand the space to not just be maybe the Boot Hill area, but include Cape and Poplar Bluff and some other regions with a little bit that are rural, but not as rural as other places. And so that's just a challenge in itself, is just the location and trying to get that funding, as you were talking about, and make all those pieces come together.
Thank you. And that's an interesting term, healthcare desert. We hear about food deserts and things like that, and access to other basic needs. But we don't think of applying that to healthcare, and that's literally what it is. That we don't have access when there's one small hospital or one doctor's office, and they don't have advanced services or what you need, and you hear about people having to be transported to the larger metro areas for more acute care or surgeries, things like that. So it's good that we are identifying those areas and those problems in those rural areas. What do you perceive as the greatest obstacles to sustaining or expanding the educational programs? And I'll speak to our two educators here. We talked about the barriers just to try to fill our workforce needs. What specifically for education? And we talked about we need money for that. And what are your institutions considering to try to overcome some of those?
So one of the obstacles that we've identified with a new program like behavioral health support is just having individuals in the organization that are able to step up and be our field instructors at the agencies, being able to, because we're in a predominantly rural area. Pettis County is, we call it the urban hub of the rural community. It's still kind of, things go from there and feed out. So being able to place those students in placements, field instruction placements that are within driving distance for them, that tends to cause some problems when you're talking about transportation and things like that. That's an obstacle. But also just the social determinants that are affecting, our general population are affecting our students as well. Strategies that our institution has done, we are the only behavioral health support program that has the web conference options. So it's very beneficial for my students, depending on wherever they are in our 14-county area. They're able to Zoom in and do the didactic portion of their learning through web conferencing. And then Monday, Wednesday, Fridays, they're out at their practicum sites doing those things. But then they have the option of coming into campus as well to practice some of those skills and things like that. So that's one of the strategies that we've put in place. But then also at our campus, we have put together care teams and caring campus model, and we're able to identify when there are problems that students are having challenges. We can quickly get them in to talk with somebody to meet some of those needs, which we can talk about a little bit more when we get to retention.
Well, I think those of us in the room whose programs have a clinical component, we could all say that we need more clinical partners and clinical site physicians, but also clinical instructors at those sites who are knowledgeable to train students, willing to take students, and they are close to our educational program. That's probably something we could all use.
Have been there long enough. So as when we saw after COVID, a lot of people were leaving those, and so we want to make sure that they're highly skilled and trained to pass that on to students. So when we're looking for individuals that have been there with a particular agency long enough to take on a student and not be burdened and feel like that's overwhelming them.
Dean Cooper, it might be a a backwards question for you because you have overseen some rapid expansion of the nursing programs at San Luis Community College. So what obstacles did you see to doing that, or what are some of the pathways that you explored in order to do that?
So I'll give you two examples here. One being from nursing, and then the other one I'm actually going to pick on Dr. Hubble, the Dean of Health
Please
Science.
do.
So the first one with nursing, people want to be nurses. I think we've already talked about the fact that, many people have it already ingrained into them from their families. They know physician or doctor, or if a physician, doctor, and nurse. Like, that's kind of where they are. There's all of these other great opportunities that are out there, but they don't know about. As far as nursing, our number one issue across the board, I think in all of nursing education, is people who want to be nurse educators. One of the hardest things to compete with right now, I mean, we love our partners, so that's not the issue, but the need for nursing at the bedside and for advanced practice is such at a high premium right now, it's not attractive to be an educator. And so while we would have previously had many people go back and get their master's degree to come back and eventually teach, at this point, the benefits of previous generations, like stability, better work-life balance, or more regular 9 to 5 and then summers off, it's just not the same draw. We're working with faculty that are under the age of 30 or are single or have no kids, and they want more flexibility, and in reality they want to be compensated at the level of which the workforce would deem their skill set to be compensated at, which is not the equivalent of an academic setting. So one of the things that we've been working on internally, I won't say too much about it, but is doing a cost analysis or a workforce analysis of what is the salary related to the workforce of that discipline. When we look at education, we often look at it as a faculty member to a faculty member. Psychology versus social science versus English, math. But here we're working with cohorted programs that require licensure, and the workforce out there would actually supersede what their current salary would be making here. How do we retain them in the face of that? We don't want to come back and badmouth our partners, so it has to fall to us to put the value back in a monetary way that says that this is the value of you coming to us in our program. Then the second one I would say would be as far as all the other great health science programs that are out there, radiology technology, dental hygiene, especially respiratory therapy. Most people don't know about these things. I mean, for years I worked in the hospital as a brand new nurse, and I'm like, oh, is that the other nurse? No, that's the respiratory therapist. Like, it's just not one of those really well-known programs. And I know our hospital partners are really pushing to, when they have those entry-level people come in, like I started off as a transporter when I was right out of high school. But I got to see those, and they're making a more concerted effort to make sure that those positions and those professions are more seen and recognized.
Who's that person in the other colored scrubs over there?
Exactly.
Yeah.
Well, and often, they wore the same color, so it was, a little hard to figure out. But yes, definitely salary adjustment, or reviewing salary adjustment, and then just marketing, advertising, and getting eyes on what those other disciplines are is really kind of the big thing for us to sustaining and being able to continue to offer these programs.
Yeah, and when we see that a lot, and I'm sure most of you in your programs have as well, that if somebody can make more money, and not just more, but significantly more money doing their profession than coming back and teaching. I mean, none of us got into this to be millionaires, educators, but there's that draw to go back out into the clinical side or the research side and make more money from that. Even state to state, Missouri is one of the bottom 5 in cost of living, which is nice, but when a nurse can make more money driving right across the river working in Illinois, which has somewhat comparable cost of living, but their base pay is a little higher, than we see some of those healthcare jobs going to neighboring states where they're offered more money. So.
And in a high demand area, we'll just use nursing as the example. When compared to other professions like law, like medicine, they are paid comparable to what they would make out in the field, actually practicing. Now, mind you, there's not the whole reimbursement thing, and lawyers that are that successful aren't going to make the same that they would when they were actually teaching, but it is comparable to what it would be beneficial to stay and do the education aspect versus kind of what we're seeing in healthcare, whereas now healthcare positions are taking more of the forefront of needing more qualified people. We have to be able to compensate that appropriately, or we can't retain them.
We see them wanting we have them wanting to come back to do adjunct teaching and things like that. And that's great because they're in the practice and they're able to really educate very well. But then that throws off that work-life balance for them. It throws off sometimes that quality of education because they're trying to juggle more than what they're able to. But a lot of times, you know, they're more than willing to do that.
And they're also temporary.
And they're temporary, right.
Yeah, we can't guarantee they'll be here every year.
Right.
Yeah.
Thank you all. We're nearing the end of our time for our first panel. I'm going to be mindful of our time, make sure we get a chance for a break before Joe comes up for our next session. So I want to open it up to the audience. Does anybody have any questions they'd like to ask of our speakers or any suggestions that you're doing at your institution for how you're trying to address some of these obstacles, the turnover in staffing, the availability of positions? Does anybody have anything they'd like to add to the discussion? And I will come find you.
Oh, this is kind of cool. Anybody, this question is for anybody. I work at St. Charles Community College, and I'm the Director of Student Services, and I do a lot of success stuff. And I'm recent to that area. I'm more on the gen ed side, so that's all new to me. But I've been working with a lot of students, and one of the issues I have, and I just need help with how do I help the students in navigating that. But I have a student working in a hospital who is not doing well at all because she's a single mom, has a child, well, you got that, right? She works for the hospital, and part of the problem is she's working 40 to 45 hours a week. And I talked to her about talking to her nurse manager about tuition reimbursement. Is there any flexibility? And she said that yes, she has talked to them, but kind of hit a wall. What are your suggestions on how I can help that student navigate that piece? Does she need to talk to somebody else in the organization, or what would you guys suggest?
Well,
Great question.
Yeah, at BJC, I do lead a team that's specifically career services for our, I don't know if she's a BJC employee. Well, then let me help her. I mean, seriously, because we might be able to help her navigate that. And sometimes it's just through relationship. I hear that frequently of like, I did talk to my manager, and sometimes it's like, I mean, I get their emails too. Yeah. Beth, I want to go back to school. Someone told me you could help me. That's all they send me. So like, so sometimes there's advocacy for how do you, right? Yes, exactly. I know you can relate. How you have that conversation with that manager, and actually that's really what my team can help with that. So like, I'm both sad and glad that they are at BJC where they can get that assistance. Also, like HR. Well, good. What does she do?
She's an extended care, I think.
Okay, yeah. So that is one thing that I commend BJC, is that we created a system so that our employees have someone to go to specifically about their career. I will send this link to Cliff because I think it's a great resource for all of you, and it's available externally. We have a career map at BJC, and we are big, and we got bigger this year because we merged with St. Luke's in Kansas City, and so we went from around 30,000 to over 40,000 employees. And despite our best efforts, I regularly talk to employees who say, I didn't know we had an education department. I didn't know we have career services. I didn't know we have a career map. Yeah, I didn't know there's resources in the learning management system. I thought I just had to do that every year for compliance, So there is a lot. Getting the word out is huge, but if you want a resource, I have all of our clinical jobs mapped on this map, and they can go in and they can look at it and look at what are the minimum requirements, and some of them have videos that talk about what is a day in the life in this role, and it starts filling in that picture of what Jordan was talking about, like who are the different colored scrubs and what do you actually do in that job. But again, like it's hard. Managers a lot of times, like all they hear is like somebody who wants to work less, and they know that they have all these spots open on there so sometimes it takes some finessing. One thing we changed at BJC recently is that you can transfer roles after 90 days in a role, and so sometimes it's a matter of finding the right spot, and it might be that they need to move on a different team while they're doing these things. So yeah, but you get it. Like, I'm pulled in both directions of that.
And you guys understand this. They are nervous about.
Yes,
Yeah.
yes.
That wasn't her big thing. Is I felt.
But I've
like
had
they're gonna not want me to-
success.
Well, that's what I was going to
Yeah.
say. Really working with that student on it's okay to advocate for
Yes,
yourself. Like,
yes.
you know, don't stop asking the question. You know, if you get a roadblock here, there's another path. So let's figure out what it is.
And when in doubt,
yeah.
go to HR.
Yes.
When in
Okay.
doubt of where to go,
Use your
start with HR.
partners, yeah. I had a PCT who graduated from our program here in December, and we knew she was about to start nursing school, and I started hearing like, it kept bubbling up to me, and I was like, okay, this is exactly who we want to support, my friends. So, and we got it, and we did get it there, but it did take some intervention, and I'm so happy to help or connect her to more
Well,
resources.
I just want to say I appreciate this conference so much because this just happened later this week, and I'm like, I don't know how to help her. Really, so thank you guys.
And one of the things that I would also recommend, look outside the college. So we have partnerships and really good relationships with Rung for Women, Slate, a lot of community programs that, you know, we have the foundation here at St. Louis Community College that helps provide students, but that's a tuition and book thing. We've got Rung and Slate and several others that we will work with for that is, you know, for single mothers or for displaced workers, and scholarships that can be even cash-based. And sometimes that can help offset what their cost is. A lot of times we have, I can't even do the program, I can't afford gas. Well, we have a connection for you that'll, you know, get you periodically gas cards or bus passes or things like that. So it's making sure that not only are we just looking for scholarship opportunities, because, I mean, that's great, but it's community college, and it's not that expensive. At the same time, how do we get them financial support in the other aspects of their life, like food insecurity, like rent, like car troubles? So, yeah, we always look outside to make sure that we can keep those partnerships alive with our people, too. So.
Appreciate that. Thank you.
Thank you very much. And that is a major obstacle that I'm sure most of us can say. How many of us have a student that's trying to pull a 40-hour work week and a full-time educational load, and they're somehow burning their candle at 3 different ends?
Yeah.
And we see burnout in the education side before they ever make it to the healthcare side to face that burnout. So I know I've experienced that with myself with students in the past, and trying to coach them through that to get access to resources and how to make it easier for them. So with that, I would like to thank our panel of speakers for their time and their expertise.